Broadcasting from Manhattan Beach and the World Wide Web, you're listening to CHSR, HealthyLife.net.
As a service to our listeners, this program is for general information and entertainment purposes only. CHSR HealthyLife.net does not recommend, endorse, or object to the views, products, or topics expressed or discussed by show hosts or their guests. We suggest you always consult with your own personal, medical, financial, or legal advisor.
We think pretty is pretty important in all things in beauty. Welcome to RadioAMB, designed for those who want to live a long and vibrant life. I'm Patty Smucker, and I'm a licensed cosmetologist who's been in the beauty industry for over 40 years. RadioAMB stands for American-Made Beauty, and it's where we tell the secrets behind the making of health and beauty products. Our segment sponsor today is AmericanMadeBeauty.com. It's a platform designed to help consumers find beauty, health, and wellness products that are implementing the industry's best practices to bring you quality products and services. Go to AmericanMadeBeauty.com and you can actually buy product on our site. That's AmericanMadeBeauty.com. You know, we're living in a time of great excitement because of the continuous change and because of the wide range of ages of people who are actively engaged in work. Never have there been people in their 20s and 30s that have had to learn to interact with and physically conduct work on a daily basis with people in the 60s to 80s. But this is the type of world that we're dealing with, and the exciting part for me, being part of that group of people that's closer to 60 than 20, is that we are facing all sorts of changes that before this generation there really hasn't been a wide body of work and research that's gone into what happens when you have this large a population who are living into their 70s, 80s, 90s, and 100s. The body is changing, and how we deal with it and how we feel about that process of aging, I think, has a tremendous effect on the way that we age. I love and own the fact that I'm almost 60, but a lot of people actually dread every single birthday. This year, as the birthday came around at 59, I said, you know, I really want to make sure that this is the year that I pay attention to all of the different things that I can do to be as vibrant and healthy as I possibly can. And one of the things that I did was to do some research about the way my body is changing as a female, and it led me to meet my guest today. My guest today is Dr. Morrisroe, who is a graduated summa cum laude and Phi Beta Kappa from UCLA, studying human physiology. She then went on to receive her medical degree from Georgetown University at Washington, D.C. Dr. Morrisroe completed her urology surgery residency at the University of Pittsburgh Health Science Center in Pennsylvania. Most recently, she completed a 2-year fellowship in female pelvic medicine and reconstructive surgery at UCLA, training under the world-renowned pelvic floor surgeon, Dr. Shlomo Raz. You'll have to help me with that pronunciation, Dr. Shelby. The only female urologist in South Bay, Dr. Morrisroe actually bridges the gap between gynecology and urology medicine. The Female Pelvic Medicine and Reconstructive Surgery Fellowship is recognized by both the American Board of Urology and the American Board of Obstetrics and Gynecology. Dr. Morrisroe is the only doctor in the South Bay who has completed this fellowship. She offers patients training and experience in a myriad of evaluations and management techniques for pelvic pathology. She also treats patients with prior failed reconstructions, including complications resulting from the use of vaginal and other types of synthetic meshes. From the simplest urological tract infection to complex diseases of the pelvic and other lower region, Dr. Morrisroe's training to diagnose and treat any and all female urology issues. Dr. Morrisroe is originally from Sacramento, California, but she's happy to call the South Bay her home. And for those of you who are not from California, South Bay is the Redondo Beach, Torrance, South Bay area. So welcome, Dr. Shelby Morrisroe. We're thrilled to have you with us today.
Thank you, Patty. I'm so happy to be here.
So I had the opportunity to look you up because I was experiencing, as I got a little bit older, some problems with leakage, urinal leakage. And so I contacted you, and we began exploring some of the various different options that were available. Tell us a little bit about how you started your career and decided to go into urology.
Well, I first decided to go into medicine in college just as a love of the sciences, and always was really technically good with my hands. I knew I wanted to become a surgeon, and then in medical school I just found pelvic anatomy and functionality so very interesting. There's just a lot of quality of life issues that go along with pelvic floor health and pelvic floor problems. The surgeries and problems are very technically interesting and challenging in a way that I really gravitated towards. I was going to go into obstetrics and gynecology, but my love of surgery really took it from there. But I kind of always knew I wanted to be a pelvic surgeon and help men and women, although I specialize more in women with these types of issues. I just get a lot of satisfaction from, helping something to function better, but to really see what a huge change in quality of life those types of issues can be for people when you improve them.
Absolutely, and as you and I have talked about since we've been working together the last 4 or 5 months, is that you really don't realize, because these kinds of changes that are related in some cases to age, in my particular case, it was something that happened slowly over a long period of time. And so it really wasn't until you were able to implement some of the solutions that all of a sudden I didn't really realize how much it was affecting my confidence. We'll talk a little bit about that later, but right now, let's talk a little bit about helping people understand the major areas of urology. When you talk about that science, what does that really mean?
The major categories that we treat as urologists, number one, is cancer of the urinary tract, which includes kidney cancer, bladder cancer, prostate, testicular, and penile cancer. We don't generally treat gynecologic cancers like ovarian or uterine or cervical. We also do a lot of kidney stone treatment, both the medical treatments for prevention of kidney stones and surgical removal of kidney stones. That makes up a large percentage of our population. And then urinary dysfunction, voiding dysfunction, which can be due to so many issues: recurrent urinary tract infections, enlarged prostates, overactive bladder, neurologic conditions systemically that lead to urinary difficulty, urinary incontinence. That's a big chunk of what we do and what I do in particular. But we also do things like erectile dysfunction, female sexual dysfunction, just pelvic medicine. That's the aspect that we call pelvic medicine, where it's often less surgical, but other forms of treatment can be helpful. I would say those are the main categories that we as urologists treat. And I do general urology, but I in particular specialize in female pelvic floor issues.
And so tell us a little bit, define that a little bit better. What does that mean, female pelvic floor issues?
Female pelvic floor issues can really encompass a lot of things. It includes vaginal prolapse disorders, weakness of the vaginal walls. It's usually a consequence of having had childbirth at some point and then the aging process, as well as urinary incontinence or leakage of urine when you're not, sitting on a toilet. Chronic pelvic pain conditions such as interstitial cystitis, also atrophic vaginitis issues, pain with intercourse. And I will tell you, it is actually a rare patient of mine who comes in with only one of these conditions. It happens, but 90% of my patients I see in consultation have some combination, some constellation of the prolapse, the incontinence, the atrophy, the pain, the UTIs. It may not be all of them, but 2 or 3 at once. It's pretty rare that someone only has one. They really are all interrelated.
And it doesn't seem like there's a lot of information out there, because you're right. I mean, and for my audience, I know we've talked about many issues. This is the most personal that I'm talking about, but I'm motivated to talk about it because I have really been struck by what a difference it's made in the way that I feel, in the way that I interact, the places that I'm willing to go. Because I just didn't realize how little by little these various changes that were going on in my body were affecting overall the quality of life.
Yeah, these changes do tend to come on slowly for people and over time, and so they're not quite as noticeable. If you wake up one morning and have a heart attack, you're going to notice it, and you get treatment, and you immediately know you have an issue with your heart. With these things, they tend to be insidious and take a while, and they're topics that women and people are uncomfortable to talk about sometimes, either to their friends or family or even their doctor. Patients will suffer from these conditions slowly for a decade before they feel confident or comfortable enough, I should say, to bring it up to their doctor. And therefore, there's not a lot of information, in the news about it because people aren't talking about it. So it's really important formats like this to kind of get the word out there so women know that this is a real common condition. These things happen to, more than half of women suffer from some form of these issues. And it's just about starting the conversation and knowing that it's, we shouldn't be shy to bring it up to our doctors and family.
Right, and that the idea that these kinds of issues exist, that it's part of, there's a variety of different reasons why they exist, and acceptance of the aging process, that it's not necessarily a negative, that there's some real positives that come out of it as well.
Oh, absolutely. And, in addition to not wanting to bring these things up, patients tell when they finally do, they seem so shocked all the time when I tell them how many treatment options and things there are, or a simple examination or blood test or review of their medications will reveal the cause of what they've been suffering from, or just to know that, gosh, I just thought this was aging and there's nothing to be done. It's just not true. There's, medicines, therapy, treatments, all kinds of things that can get them back to their baseline or even better. It definitely does not have to just be a normal part of aging.
Well, I know we're going to spend a little bit more time diving into some of the specifics, but let's talk preventative. What are some of the things that we can be doing throughout our lives to make sure that we are as healthy as possible in the pelvic region?
That's an excellent question. Let's see. It encompasses prevention of many different disorders. I mean, definitely the best thing you can do for health of the pelvic region or really anywhere in the body is to eat a good, healthy diet, to avoid obesity, things like that. Put weight on the pelvis, increased risk of incontinence and prolapse, increased risk of urinary tract infection, cardiovascular health and diabetes. When those are comorbidities, they increase chances for all kinds of other problems too. So number one is just being healthy, eating well, avoiding heart disease, diabetes, and obesity. But in addition to that, things like for urinary issues of overactive bladder, incontinence, you want to make sure you're not doing the opposite maybe what you should be doing by over-drinking. Patients tell me all the time, I'm supposed to drink 8 to 10 glasses of water all the time every day, but if you've got an overactive bladder, that can be harmful. Avoidance of too much alcohol or caffeine can hurt the bladder in some ways like that. Pelvic floor strengthening and exercises is a great habit for younger women to get into, especially after childbirth. Most women have heard about those Kegel exercises, the sustaining a contraction of the pelvic floor for about 10 seconds. But if you get into the habit as a young person, especially after childbirth, that can really help maintain tone of the pelvic walls and help to reduce or prevent prolapse or incontinence down the line. So that's a good one that I know a lot of gynecologists do teach their patients about after childbirth, but people should really pay attention and do that.
Right. And so when you're working with a patient, give us a little bit of an idea of what someone would expect if they were going to seek out the services of someone in your field. What would that look like in terms of that first evaluation?
Well, a first evaluation with me for any constellation of these issues is mostly discussion of their medical history, their gynecologic history, their symptoms. It usually involves a pelvic exam, assuming the patient is comfortable. However, pelvic exam for most of these issues do not include a pap smear or anything too invasive. But we need to rule out infection. We need to look at the anatomy. We need to see if there's prolapse or any other dermatologic skin conditions pelvically, which can contribute to these symptoms. It's taken a thorough history of their medication list, which, again, can also contribute to a lot of these symptoms sometimes. So, yeah, mostly discussion, an exam, review of medications and history, talking about all the potential tests and treatment options we're going to, be working towards, and then coming up with a plan together.
And is medicines, various different types of medicines that can be problematic with these kinds of issues as well?
Oh, yeah. good medicines and bad medicines. There are cardiac medicines for high blood pressure and diabetes, which have a significant impact on the urinary tract. So it's not necessarily they need to stop, but maybe they could be changed to something different. But they can lead to incontinence and frequency as a side effect, and a lot of patients are not aware of them. A lot of women take diuretics, which are water pills, which can increase risk of, frequency and leakage. And sometimes it's just a matter, actually, of adjusting the time of day women take certain medications. I have a lot of patients on these diuretics, and they take them at the wrong time of day because that's what they were, just thought they were supposed to do. But just saying, hey, instead of taking it in the morning, take this in the evening, that alone can solve a lot of the problems when it has to do with urinating at night or leakage at night and things like that. And there's other medications that affect the brain, like depression medications or CNS-affecting medications can absolutely affect the bladder. Simple medicines over the counter like Sudafed can cause urinary retention and urinary issues. There's a lot of herbs and over-the-counter stuff, too, patients tell me about that can cause bladder irritation that they don't realize. So in addition to medication, we go over supplements, as well. There's a long list of medicines that can have different effects on the bladder that definitely needs to be looked at that first evaluation. Right.
And so when part of what led me to you was I had an opportunity to learn about, in particular, something called the Mona Lisa touch. So let's talk a little bit. I know we've only got about 5 minutes in this segment, but let's dive in a little bit more to those female issues and in specific some of the newer technologies that you're using to deal with some of those female issues.
Well, female issues in general, the interesting thing is a lot of these treatments aren't actually new. They're just new to people and practitioners who've not heard of them. I treat a lot of overactive bladder patients, which is symptoms of urinary urgency, frequency, and possibly urge incontinence when you got to rush to the bathroom, you can't quite make it. We do different types of medications and therapy for that treatment, which those have been around for a long time, but we're actually doing bladder pacemaker insertions. They're sacral stimulators that we implant under the skin near the hip that can actually control the nerves, the bladder and pelvic floor to calm them down. That treatment has been around almost 25 years. We've had it for a really long time. It's just not well known about. We do an acupuncture type treatment called posterior tibial nerve stimulation, which is an office treatment, which is actually very effective, also been around for more than 20 years. And sometimes we do office Botox injections. Most women think of Botox as that toxin that's injected into the forehead to paralyze the forehead muscles for wrinkles. But believe it or not, we inject Botox all over the body, anywhere we could get a therapeutic effect of muscle paralyzation. And it's the same in the bladder. If you've got a spastic overactive bladder, we can inject this medicine directly into the bladder in the office. It takes 3 minutes, and it will partially paralyze the bladder to take away that urgency, frequency, and rushing for up to 9 months. And again, what I find most interesting is that these have been around for more than 20 years. And when I tell people, they say they have never heard of this before. And honestly, when I talk to a lot of their primary care doctors and practitioners, they didn't know that these were options either. So some of these things aren't even new. It's just about getting the information out because the information is new to patients and doctors.
Well, and it goes back to that whole issue before that we were talking about before, that these are real issues that exist, but so many people are embarrassed by it. I know myself in gathering with family recently and talking a little bit about the treatments that I had with you, there were some people who were like, tell me more, and other people were like, TMI, man, just stay away from me because I really don't want to talk about that.
Right. And there's always going to be a little bit of that with these issues, but I think the more people hear people talking about it, the more it becomes less of a stigma or something, embarrassing.
Well, and as we wrap up this section, tell us a little bit about that quality of life aspect of it, because I keep hitting on that, but I know that's important to you.
Thing to gauge. I can make the amount of pads a woman wears less. I can decrease their leakage or help with their pain during intercourse, and that's an objective thing. But it's impossible to measure really how much that just affects every aspect of a woman's life. I mean, to not have to wear 8 pads throughout the day that are wet, where there's a smell and you're embarrassed to go out in public, you don't want to leave your house. I haven't just fixed her leakage, which medically could lead to infection, so it's not good. We can completely change someone's life, make them go, they feel like they can exercise again without fear of leakage. They feel like they can leave a house without fear of smell. If we can improve their sexual function, all the benefits that come from having, a healthier sexual life and without pain with sex. I mean, it improves quality of life issues in innumerable, uncountable ways. It's really quite wonderful. And that really is kind of why I went into this field, is I'm so touched and moved by how much the quality of life aspect of what I do in some people is just seems overpowering to the medical benefits.
And so as we look at not only just female issues but also men, I know talking with your nurse that there's also a tremendous amount that you're able to do with males as well. And when we come back, we'll talk a little bit more about that. So we're going to take a break, and when we come back, we'll talk in more detail about some of the application for female as well as specifically some things for men. So stay with us. We will be right back.
Over here. Here's a secret for a virus-free computer. ESET. They've been a pioneer in the antivirus industry for over 25 years. 25 years of innovative, top-rated antivirus protection. ESET's award-winning security solutions provide a safe online experience for over 100 million home and business computer owners. They are so affordable, fast, and simple to use. So be gone, you blue screen of death. ESET's on my computer. If it's not on yours, visit HealthyLife.net's advertiser page and click on ESET now.
Here's the thing about beauty. It's pretty. At AmericanMadeBeauty.com, we're all about the pretty, making it easy for you to find what makes your beauty shine. We have essentially everything you need, and AmericanMadeBeauty.com celebrates brands that were created right here in the U.S. of A. Imagine everything you need from the best hair, skin, and nail products to makeup and even the tools, because it's all about pretty at AmericanMadeBeauty.com. We also think you're pretty important, so visit AmericanMadeBeauty.com. Browse, buy, learn. AmericanMadeBeauty.com. We're looking for a few good American beauty manufacturers who want to increase their brand in an exclusive credentialed category. If you're an American company who has conceived, designed, and bottled brands that are all about pretty, then we're pretty sure we're talking about you. And we're pretty sure you should be on AmericanMadeBeauty.com. This beauty website focuses on entrepreneurs and beauty startups as well as established brands. If it's pretty, we want to see it, and we want to sell it on AmericanMadeBeauty.com. To learn how you can be part of AmericanMadeBeauty.com, visit AmericanMadeBeauty.com now.
What does HealthyLife.net and Amazon.com have in common? Well, they're both available on the Internet. They both give great value. But most important, most of our positive program hosts and guests are accomplished authors, and their books are available from, you got it, Amazon.com. Now, it even gets better than that, because when you're listening on air to a HealthyLife.net host or guest, you can go directly to Amazon.com and you can order your book while you're still listening to your favorite HealthyLife.net program. So when you hear an author you like, go to the homepage of HealthyLife.net and click on Amazon.com.
Where positive people and radio unite. HealthyLife.net.
Welcome back. This is Patty Smucker, and you're listening to RadioAMB on HealthyLife.net. I'm here with Dr. Shelby Morrisroe, a urologist who I had the good fortune to meet and have been working with this year because I was having a variety of different types of female issues that I've just been delighted to have an opportunity to address and really have experienced firsthand how much it's changed the quality of my life. Doctor, let's talk a little bit in more detail about the female issues. We talked before about cancers, and you said specifically that you do diagnose and treat kidney, bladder, prostate, and a variety of different types of cancer specifically for men. Why not treating vaginal cancer?
You know, it's just an area of treatment that's been more classically treated by gynecologists.
Okay.
So it's just not something we trained in, specifically the cancer aspect. But that's the main area that differs between what gynecologists and urologists such as myself treat.
Okay. And so how did you come upon your methodology? Because it sounds like you are, and the introduction, we talked about the fact that you're one of the first that have done this fellowship, sort of bridging the gap between urology and gynecology. Tell us a little bit about how all of that developed.
Yeah, well, this fellowship you can enter. It's basically 2 years of extra training beyond residency in this specific female pelvic medicine and reconstructive surgery, and it allows for both urologists and gynecologists to enter the fellowship to be trained in somewhat of the other methods from the other field, because there's a lot of overlap in what I do with a gynecologist in this way and vice versa. But it's a relatively new fellowship the last 5 years or so. So there just aren't as many people who are specifically trained in it. But we get to train with urologists as well as gynecologists as well as colorectal surgeons in this field to get a much broader experience, so we can really treat the whole pelvic floor. And we haven't even really gotten into it, but that also includes fecal incontinence, chronic constipation, some other kind of fecal issues too that again, they're all related in a lot of people, so we can kind of manage the whole pelvic floor health in these women.
Well, it just seems smart in that we're not dealing with the body in a mechanistic perspective and more holistic. Yeah.
And that's where I think this idea came from. Is these are so typically interrelated issues. You can't just treat one alone. Or why would you want to? Sometimes the same principles can apply to the whole area, or if you're treating one, we can manage multiple things at once. That's exactly right.
And in particular, you have gone into an area that involves lasers. Tell us a little bit about that work.
Well, the laser that we use, the Mona Lisa Touch laser, is new. It's been around for about 5 years, about 3 years here in the United States. And it's basically a treatment for atrophic vaginitis, dryness of the vaginal tissues, pain with intercourse, recurrent urinary tract infections, basically all of the sequelae that a woman can have as a consequence of low estrogen levels to the vaginal tissue, which again can lead to urinary issues, pain issues, dryness issues, incontinence, infection. And for decades upon decades up until this treatment came out, the only treatment option we had to reverse some of those changes that were leading to those symptoms was the use of local estrogen, either a cream or suppository applied to the vagina to re-give the estrogen that was missing after menopause or after breastfeeding. But we started using this CO2 laser, which started in Italy, hence the name Mona Lisa Touch. And we have such surprisingly wonderful results, and it's without the use of any hormones or medication or risk. And there's been a lot in the news lately of increased concern of the risk of using hormones for all the negative potential side effects, risks of cancer. And so this treatment really came at a time quite wonderfully when, a lot of women were stopping all of their hormone replacement therapy for other reasons anyway, and then really had nothing to turn to.
Right. And for me, as a breast cancer survivor, the hormone therapy wasn't even an option. So this was...
Exactly right. This was actually developed for women with a history of breast cancer who had these symptoms, and 60% of all breast cancer survivors do complain of some types of vaginal atrophy, dryness, pain with intercourse. And this is where it was developed, but it worked so well that it very quickly got into regular use for women, even without a history of breast cancer.
And so tell us exactly how the laser works.
Well, it's a fractional CO2 laser, which that type of laser was invented in the 1960s. So, again, this is not some new technology per se. We've had this for decades upon decades of safety information on it. But it's a laser that we use with a vaginal probe, a small vaginal probe that supplies light energy to the vaginal walls that targets the water under the surface, and it creates these hundreds of little pinpricks that are kind of stamped onto the full length of the vagina in a 360-degree pattern. And they're very tiny and they're painless, but they stimulate a healing response. So you get regeneration of vaginal tissue, which promotes proliferation of the cells and restoration of the vaginal wall strength and blood supply, brings in new collagen. You're basically causing these minor traumas, these micro traumas that stimulate growth, healing, and rejuvenation of the cells, thickens the vaginal wall mucosa, increases natural lubrication, softens the tissue, strengthens the tissue. And because you are just improving the health of all the vaginal tissue and potentially the external labial tissue as well, you get less dryness, you can get less itchiness, less pain with sex, more distensibility, less risk of infection, less risk of vaginal yeast infections with an improved pH from the treatments. So it's pretty remarkable how you're really just doing one thing, improving the health of that tissue, but because of that, you can improve so many different symptoms. And when we began talking about this, for me to talk about it on the radio, I really felt like I needed to experience it, and that's exactly what I've done. So 3 treatments, paced, they were 6 weeks apart. Is that right, Doctor? That's right. Between 40 to 50 days apart, 3 treatments is the standard regimen. So it takes about 3 to 4 months. Yeah. And, after the very first treatment, the difference was remarkable. Everything that you just said in terms of the results were literally instantaneous in terms of, over the next couple of days. And my experience of it itself was that the prep for it was more work than the actual, what you did. And the first time, literally, there was no discomfort in it at all. I had a little bit more discomfort in the second and third treatments, but minor as compared to, going and having hair laser removal done. So I thought that was a very interesting aspect of it. And then what's the maintenance, doctor? After the 3 treatments that you do 6 weeks apart, what's then can a patient expect? Happy with the results. Most women, you do have to do some type of maintenance to maintain those benefits because your body no longer produces that level of estrogen. Those changes will come back otherwise eventually. So the most common regimen is to come once a year for a one-time treatment for maintenance. Unless for some reason you feel symptoms coming on sooner, you can't. Some people do come as often as every 6 months for a one-time treatment. But the most common regimen is just once a year maintenance, one-time treatment to maintain the benefit that you got initially. Right. And I know that at this time it's not something that insurance is covering. Do you anticipate in the future that it would? As far as we are being told, there's no anticipation for insurance covering it. That's not to say that it couldn't happen someday, but it's just not on the horizon for now. Right, right. And are there other applications for this particular type of CO2 laser that you're using in your practice? Not in our practice. You can use it to burn warts. People use it for facial resurfacing, other areas of the body, but currently, at least in my practice, it's the only way that we're using this laser. And, I also found it very interesting as well when we researched it. We actually looked at doctors from all different disciplines. So there's cosmetic surgeons that are offering the treatment because obviously they get into it from the plastic surgery perspective and using it for facial resurfacing. But we found gynecologists, cosmetic surgeons, as well as urologists doing the treatment. So I find it very interesting. All right. We're gonna wrap this up, and when we come back, we'll talk a little bit more about some of the other interesting work that Dr. Morrisroe is doing. So don't go away. We'll be right back.
Here's the thing about beauty. It's pretty. At AmericanMadeBeauty.com, we're all about the pretty, making it easy for you to find what makes your beauty shine. We have essentially everything you need, and AmericanMadeBeauty.com celebrates brands that were created right here in the U.S. of A. Imagine everything you need from the best hair, skin, and nail products to makeup and even the tools, because it's all about pretty at AmericanMadeBeauty.com. We also think you're pretty important, so visit AmericanMadeBeauty.com. Browse, buy, learn. AmericanMadeBeauty.com.
For all your live or pre-recorded webcasting needs, come to earthchannel.com. Get your web-based message out to a select group or the whole world. It's easy. A pioneer in webcasting, earthchannel.com provides the best products and services to big corporations and government users. And now this same technology is available to you. They have the best Earthcast encoders, servers, and products to meet your technical needs. But wait, don't want to mess with technical stress? No problem. They'll do it for you. EarthChannel.com is your answer. You can use webcasting for lots of things like advertising, marketing, customer support, training, and don't forget web radio and TV. In fact, you're listening to a live Earthcast right now. So come to EarthChannel.com. Actualize your audio or video webcasting needs today. You can't beat the friendly service or the price. Call earthchannel.com at 1-800-849-8978. That's 1-800-849-8978.
We're looking for a few good American beauty manufacturers who want to increase their brand in an exclusive credentialed category. If you're an American company who has conceived, designed, and bottled brands that are all about pretty, then we're pretty sure we're talking about you. And we're pretty sure you should be on AmericanMadeBeauty.com. This beauty website focuses on entrepreneurs and beauty startups as well as established brands. If it's pretty, we want to see it, and we want to sell it on AmericanMadeBeauty.com. To learn how you can be part of AmericanMadeBeauty.com, visit AmericanMadeBeauty.com now.
When you're looking for bedding, department store prices can shock you. Well, be shocked no more. Sell steak cheap, not cheap steak. That's the motto of Anna's Linens. Although they don't sell steak, they do sell the best bedding, bath, and home decor items. They strive to provide their merchandise at extreme value to their customers, and they do it. Great everyday prices on everything and military discounts. Plus, if you visit them online, they have clearance items and internet specials. Visit them online now at HealthyLife.net's advertiser page.
Radio your way. HealthyLife.net.
Well, thanks for staying with us. This is Patty Smucker, and you're here listening to Radio AMB on HealthyLife.net. I'm here with Dr. Shelby Morrisroe, who is a urologist that I've had the pleasure of getting to know this year, as she has been providing me services and really has made such a huge difference in the way that I'm feeling and how I'm conducting myself because of being able to do a Mona Lisa touch treatment on me. And so I went to see this doctor specifically because I was having this problem, and I began doing some research. When do you find, doctor, that what are some of the reasons why men specifically look you up and come to get services?
Well, we treat men's issues, pelvic health issues in terms of things like low testosterone or erectile dysfunction. Those are probably the most common two men's health issues that men come to see me for, which is a different can of worms in terms of treatment options and things. But a lot of the problems have similar hormonal type etiologies that we look into. We definitely do more hormonal testing in men, again, for things like PSA testing, and then the testosterone levels, free and total, other hormonal issues. But there's a wide variety of medical or even sometimes surgical options for them as well, but very different than the things we offer the women, obviously.
And so when you're focusing on that, I want to talk a little bit about the PSA testing in a minute, but so tell us in general the approach that you would, the options that you have available for these kinds of things for men.
Well, consultation for these issues are similar to the women in that it's always a large part of it is a review of their medical comorbidities, medical problems, medications, past surgeries. Those things very often have a big impact on diagnosis and why men have certain issues, but they also involve an exam. There's a lot that we can glean from a physical exam with a man in terms of the symptoms that they're having. Lab work as well in men is very important for those labs we talked about before. And then treatment options, it really, depends on what we're talking about. Erectile dysfunction, there's, lots of erectile dysfunction medications. If testosterone levels are low and someone is symptomatic, we'll talk about testosterone replacement therapy. Surgical options for these things as well. For severe erectile dysfunction, sometimes we'll implant penile prostheses. We have mechanical, non-medical, non-surgical options. Sometimes we have men see a representative who has a vacuum erection device company that they kind of show them how this device works, and it's a nice bridge between not surgery, not medicine, and it's fairly effective. And it's yet another treatment that some men are just very shy to talk to their family and doctors about, and they don't realize there's really lots of things out there beyond just that Viagra pill.
Right. And so let's talk for a moment about the various different types of options for medication for erectile dysfunction. Viagra, is that still the what everybody recognizes? But are there other options?
Yeah, the Viagra is a name that most people. It was the first brand name that came out that most people think about, which actually just came out in a generic form earlier this year. So that's a nice option. The price has really come down on that one. And that was a big inhibitory factor for a lot of people for years, is those pills were so expensive, and now they really aren't. But because of side effects and tolerability, we have Levitra, we have Cialis, we have Stasin. There's multiple different medicines. They're all the similar class, so they try to do the same thing, but they're slightly different. So one person might tolerate one better than another because of the side effects or profile slightly different. And again, testosterone levels, if those are low, replacing someone's testosterone can actually help erectile dysfunction. We also can teach men how to do self-penile injections with a very, very tiny needle of a slightly different type of medicine, which brings blood flow into the penis. So it's a medication, but it's injectable form rather than oral systemic, and sometimes just for side effect tolerability, men prefer that. So lots of options.
And much like women, are there preventative types of things that can be done and or medications that contribute to the problems?
Just like in women, very much the same. Obesity, cardiovascular disease, and smoking are the three top things that can contribute to erectile dysfunction issues in men, things that affect small blood vessels. Certainly proactively avoiding those medical health concerns, or if you are a smoker, quitting smoking can absolutely reverse or improve erectile function issues. That's number one. And there's definitely a lot of medications that can affect sex drive, libido, semen production. And again, for us, they're very easily recognizable when we run that list of medications at our initial consultation. And there are things that you wouldn't think about. And those are the type of side effects that I know when doctors prescribe them for, high blood pressure or depression or whatnot. They rarely mention the potential sexual side effects. I think because even then it's kind of an awkward thing to talk about. And patients take them and they don't know. Right.
And do you find that that men are coming in? Is the age pretty standard? Is it getting younger? Or, what are you seeing a difference in terms of men who are willing to come in and ask for help?
The majority of men who come in and ask for help are around that age 50s to 60s, where they're still pretty sexually active, but they're absolutely noticing the declines in erectile function, semen volume, sensation that we tend to see for a multitude of reasons as we get older. But, we definitely see men in their 30s and 40s. I definitely have patients in their 80s and 90s. Like anything when it comes to sexual health, it's kind of always a mixed bag. But similar to women having more, issues around that time when hormones are changing, men start to lose their testosterone around that age in significant ways that can more quickly change how they feel there. So that's probably where we see the most age range.
And with men as well, you mentioned earlier that you also do vasectomies.
That's right.
So are you seeing a change with regards to that particular service and the type of men that are coming in for help?
A change in the vasectomies?
Or age or why they're doing it?
No, I don't think so. I haven't. It seems fairly unrelated to the erectile dysfunction, but no, that's usually men in their 30s, 40s, sometimes 50s.
That are coming in, yeah. And so when you mentioned earlier with regards to these various different types of medications, and you said as well diet and things like that, is testosterone taken orally? Does that help long term?
Well, we don't prescribe oral testosterone. It's too high incidence of liver disease. It's always given as an injectable or a topical patch.
Okay.
But it helps in the case of low testosterone, lower than the normal range levels. If someone is symptomatic with low testosterone, symptoms of low testosterone is, decreasing muscle strength, decreasing muscle mass, increasing body fat, lower energy, lower sex drive or libido, or erectile dysfunction, some constellation of those symptoms, along with a blood test that shows that it's actually low. Those men can very often benefit from taking testosterone supplementation, either again through a shot or topically. Absolutely. We don't treat men for quote-unquote low T, which is a term a lot of people hear about or see commercials, unless it's symptomatic. Just that number being low isn't a reason to treat. They've really got to have some combination of those symptoms.
Right. All right, great. Well, we're going to take another break here as we're learning more about this whole area, and as it relates to American-made beauty, we're talking about this because it is a topic that so many people are shy about speaking. And I know for myself, and having actually experienced both the slow decline in terms of beginning to have a little bit of personal leakage and not being really sure what to do about that and things like that, it's really been something that's been life-altering. It's changed quite a bit for me to get involved and to do something about that. So we're going to take a break, and when we come back, we'll wrap up in this last section and talk about some of the other types of treatments that are available that help to affect a person's quality of life. So stay with us. We'll be right back.
Here's the thing about beauty. It's pretty. At AmericanMadeBeauty.com, we're all about the pretty, making it easy for you to find what makes your beauty shine. We have essentially everything you need, and AmericanMadeBeauty.com celebrates brands that were created right here in the U.S. of A. Imagine everything you need, from the best hair, skin, and nail products to makeup and even the tools, because it's all about pretty at AmericanMadeBeauty.com. We also think you're pretty important, so visit AmericanMadeBeauty.com. Browse, buy, learn. AmericanMadeBeauty.com.
When you're looking for bedding, department store prices can shock you. Well, be shocked no more. Sell steak cheap, not cheap steak. That's the motto of Anna's Linens. Although they don't sell steak, they do sell the best bedding, bath, and home decor items. They strive to provide their merchandise at extreme value to their customers, and they do it. Great everyday prices on everything and military discounts. Plus, if you visit them online, they have clearance items and internet specials. Visit them online now at HealthyLife.net's advertiser page.
We're looking for a few good American beauty manufacturers who want to increase their brand in an exclusive credentialed category. If you're an American company who has conceived, designed, and bottled brands that are all about pretty, then we're pretty sure we're talking about you. And we're pretty sure you should be on AmericanMadeBeauty.com. This beauty website focuses on entrepreneurs and beauty startups as well as established brands. If it's pretty, we want to see it, and we want to sell it on AmericanMadeBeauty.com. To learn how you can be part of AmericanMadeBeauty.com, visit AmericanMadeBeauty.com now.
Oh, man, it never fails. My suitcase just got ripped apart.
Life is a journey. Make it a pleasant one. Use Samsonite. You know the name. For almost a century, Samsonite luggage has proved itself to be the worldwide leader in innovative travel solutions. Let it be yours. Visit HealthyLife.net's affiliate Samsonite on our homepage and click to look at the fine luggage from suitcases to golf travel bags. And don't forget, take a look at their travel accessories. Make life a journey, a pleasant one, with Samsonite.
HealthyLife.net, where positive overcomes negative.
Welcome back. This is Patty Smucker, and you're listening to RadioAMB on HealthyLife.net. I'm here with Dr. Shelby Morrisroe, a urologist here in Southern California, who is really being a pioneer in offering all sorts of different types of solutions for people who are looking to improve their pelvic health. So, Doctor, tell us a little bit about, we've talked about the Mona Lisa Touch, and we've talked about some of the various different things that you're doing with erectile dysfunction. Talk to us about some of the other options you have in your arsenal for treating pelvic health.
Well, one of the most common things that women come to see me for is urinary incontinence, and there's kind of a basic algorithm for how we work them up and treatment options, and I always try to give patients an overview of everything that exists out there before they leave that first appointment, not to overwhelm them, just so that they walk away thinking, wow, there's so much that can be done, because that's the biggest, thing I think with incontinence treatments is people just don't realize how much there is out there, and in case there's some reason they don't come back, I want them to know, or if the first thing we try doesn't work, I want them to remember that there was 5, 6 other things that could be tried. Again, initial consultation is going to be a long discussion, review of medical history and medications, a physical exam. But if we're talking about the most common thing, which is basically overactive bladder, urinary urgency frequency, rushing, can't make it, we'll talk about their dietary things, their fluid intake, caffeine, alcohol can all contribute to the problem. I'll typically offer a referral to see one of our pelvic floor physical therapists to do bladder retraining exercises, basically a completely conservative, safe, non-medicine, non-surgery way to try to naturally improve the symptoms. If they don't want to do that or that's not enough, we'll talk about medication, of which we have multiple different bladder relaxant medications to try. At that point, if they try those things or for some reason can't try those things, we'll do some testing to rule out other pathologies or reasons for their symptoms, and then potentially go on to our kind of refractory overactive bladder treatment options, which are all pretty actually simple and non-invasive. One being like the acupuncture treatment for the ankle. There's a nerve in the ankle that actually has a reflex reaction to relax the bladder. So we can stimulate it in the office on a chronic basis to relax the bladder to help with the leakage. The Botox injections is done once or twice a year in the office, takes 3 minutes. It can also relax the bladder to help against those symptoms. And probably the most invasive, although still pretty uninvasive, just a minor outpatient procedure to put that bladder pacemaker in under the skin that we talked about before. And, again, these are all things we've had for more than 20 years. They're tried and true. They work very well with a high success rate. And I would say 90% of patients who come to me have only ever been put on those bladder medicines you see commercials on TV for, and were never told that these other options existed, like physical therapy, the procedural options, the Botox. And, again, the main thing I just want people to know at that first appointment is even if we're not ready to go down that pathway with these things, please remember that they exist, and let's continue the conversation to talk about them, because it's pretty rare that we can't get someone better.
And I love the idea that, the bladder retraining, I mean, that's huge, and really just understanding. I know I hurt my back a couple of years ago, and going to someone to understand how to position my body properly when I'm doing yoga was like night and day. So having somebody that knows that aspect of it makes a huge difference. But I love this whole idea of the acupuncture. And who knew? Something around your ankle that could affect the
It's another conservative option, that it's risk-free, it's pain-free, it cannot make you worse. Mm-hmm. It's as simple as acupuncture, but it works about 65% of the time to decrease the overactivity of the bladder. So, and again, we've had it for more than 20 years. It's technology. It's always getting smaller, better, more efficient, but, we've had a version of it for a really long time. It's very safe and very simple.
Right.
But unless you come to someone who specializes in these types of treatments, you're just not going to hear about them from another doctor.
Right. As you look back on the period of time that you've developed your practice, is there any sort of aha moment that stands out as, wow, I love what I'm doing?
Oh gosh, an aha moment. I don't know that I have a single aha moment. I feel like I feel that way all the time when, I just get an excellent result. Someone's incredibly happy, and I will tell you, it's the quality of life reasons that make me feel that way. Mm-hmm. I removed someone's kidney stone and their pain is gone. Trust me, I'm happy. I feel good. But it's very different than when someone, hugs me after surgery because they're now dry, and again, they can exercise, or they can have, sexual relations again without severe pain. And, I'm the happiest when someone tells me their quality of life has changed significantly, but I actually think they're the happiest. Those are the patients who seem happiest about the benefit they've received when it really impacts the quality of life versus, removing a kidney stone, or shockingly, even removing something like a small bladder cancer, you would think. And those patients are grateful, but gosh, you don't see the tears in the eyes and just the joy that you get when you really, really impact someone's quality of life.
Well, and what I really appreciate about your approach to medicine, which I'm hoping we're motivating other physicians to go in that direction, that's number one, that your approach is holistic, that you're looking at all of the various different types of systems within the body that work with one another or work against one another. So that, I think, is a rather important attribute. And that you're educationally oriented, to sit me down and to have spoken to me about all of these various different things. Right from the very beginning, when I went in, I felt a little bit of hopelessness in terms of, oh my gosh, I'm finally at that point in getting older that these things are not curable. So the fact that not only did you have one option, but that you had many was really exciting and really...
Again, what I find the most interesting, that how many patients come in just not realizing there's not just one option for them to try, but there's many things.
Right, right. And so what do you tell patients, for our audience that's really not only all over the United States, but actually all over the world, what would you recommend for someone who didn't have the option to access the services of a great person, a great doctor like yourself?
Well, I know in particular for the Mona Lisa touch procedure that we in part were talking about today, there's many you can Google online and many different ways and find providers. The website that I find probably the easiest to look up a local provider is www.smilemonalisa.com. Just smile, S-M-I-L-E, monalisa.com. And there's a tab that says Find a Provider. You type in your zip code, and it will show you everyone in your area that offers that service. That's probably the easiest way to find someone for that treatment option. Okay.
And just in terms of a urologist, any particular way that somebody goes about finding a qualified person?
To find someone qualified in exactly what I do, I would recommend, if they remember to the exact name of this fellowship training, to look for providers who are trained in female pelvic medicine and reconstructive surgery. It's a mouthful, I know. But, a lot of the urogynecologists, if you look them up by that, have that training as well. It should tell you. But it is a relatively small field. It's not. There's not going to be a lot in any one city.
And in this day and age, having the opportunity, with the Internet, there's all sorts of different ways that you can research, but be proactive, and make some decisions about your health. This was how I started my year, was making some decisions about my health, really looking at some of the different things that I wasn't happy with, and wanting to research and find out what's available. And I'm just delighted that I've had the opportunity to find you, Doctor, and thank you for the work that you did for me as well as the work that you're doing in the world.
Thank you so much.
All right. Well, that's going to wrap it up for us today. Thank you very much, Doctor, for being with us. Next week, we'll meet Huda Quisha, who owns the first Muslim salon in New York. Join us when we talk with her to learn about her journey and what motivated her to open a safe space in the Big Apple. Send us your comments and questions to requests@AmericanMadeBeauty.com. Thank you for listening to Radio AMB, where we think pretty is pretty important in all things in beauty.